Okay, so air and fat embolisms. So both of them are going to present with respiratory distress, JVD, and drop in blood pressure. So how do you differentiate between them? So air embolism is, first of all you need is about 120 cc's of air for an air embolism to happen, which is like very, very tiny. The way the question they ask you is you need to be able to clinically recognize which one it is in terms of the clinical context, how the question is being set up. And they ask you what could have been done to prevent it and how would you manage it once it has happened. So an air embolism, typically the context that it happens in is someone is a trauma patient or they're on a ventilator and they suddenly die or suddenly go into cardiac arrest, or they're having a subclavian vein being opened because they're doing a supraclavicular node biopsy, or they're putting in a central catheter, central venous line. And when you're entering that great veins of the neck, in order to prevent an air embolism, you should put them in that Trendelenburg position. That's where the question would be whenever you're entering the great veins. And what are you going to do after this happens, an air embolism? Well, you have to do CPR, put in a chest tube, and do a cardiac massage and rest of the supportive treatment. So, and a fat embolism, it's going to have the same presentation again. Again, the jugular venous distension, the drop in blood pressure, and respiratory distress. But the clear-cut characteristics that you're going to find here is the petechiae. The petechial rash in the neck and axilla, as well as thrombocytopenia. Those are two big points. And how can you, and also on the chest x-ray, it can show bilateral patchy infiltrates. So how can you prevent it? Or how can you prevent it? And it's associated with long bone fractures. So if you see a case where they have this and they ask you the question, well, how can you prevent it? One is to do the early fixation, the surgery that's needed, and do as early ambulation as possible. That's really, that really helps. So that's about it.